Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner.
That you are.
And I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. How you doing?
I'm good. I'm gonna lift you up.
Me up.
Because today we are talking about body lifts.
Don't make fun of my kyphosis, Amy.
Yeah, you did like 7 hours of surgery today. You can be a little hunched. That wasn't active time.
It felt
hands
active.
On time.
It felt active.
Hands on time.
You like at the beginning of the cases, you're corralling cats to get people going. So
yeah. So today we are talking about body lifts.
By the way, I am like sitting up more right now.
You are, yes.
Really
You've been
focusing
lifted.
on my posture.
Yes.
Sorry.
If you are listening to this episode and you would like to watch us, you can find all of our social media handles here. We're on YouTube at Jason Martin MD and everywhere at Beauty and the Surgeon podcast. This is a good topic. So this is part 1 of 2. In our deep dives of surgery procedures, we usually do these as a 2-parter just because there's a lot to kind of digest. In the first part, we're going to talk about the statistics, who's a candidate, how to choose a surgeon, some considerations about risks. And then in the second part is where we're going to really deep dive into the surgery itself.
The stuff that matters to me. That's what she's saying.
And recovery too.
Yeah.
So part 2 is all about the actual details of surgery and the recovery component, but you should not skip part 1 because we talk about some very important things in part 1 as well.
Yeah. Especially with this surgery. So something I'm very excited about is that we finally have the statistics from the board. What?
Yay.
They did their job and they released it?
I feel like they basically skipped all the way from like 2020 to 2024.
I think COVID really messed everything up for them.
Yes. So either way, we finally have statistics, and these are really cool to look at, and they're going to be even more fascinating to look at next year for reasons that I'm sure we'll discuss. But looking at 2024, so the increase from 2023 was pretty static. It was only a difference of literally 10 cases. So a 0% change. The breakdown between men and women, there's still far more women who do this procedure than men in 20.
So 90% women.
Yeah.
Wow.
Yeah.
Wow.
Well, and I think we'll kind of talk about some of the reasons perhaps why. But also the age breakdown here, we're seeing the biggest amount of this population being anywhere from your 30 to 55 range. And then obviously on either side of that, it's much less. So that's pretty typical of a lot of surgeries, especially because in most cases, these are self-pay, and people need to have the ability to pay for them. So that's usually when you're over 30.
Also, childhood obesity is real, but people tend to gain weight over their teens and their 20s and then lose weight, ultimately, usually for health or personal reasons.
Yeah.
So it gets them into their 30s.
Yes, for sure. And this is a big procedure, so it's not something that should be undertaken lightly. So that's, I think, also why we see that in the more kind of, I'm not saying mature in a bad way, but that more mature age range, for sure. So let's talk about what a body lift can do.
First, it removes the excess skin and some of the sagginess of your skin. Also fat around the belly, around the butt, and somewhat into the lower extremities.
Yeah. And, you can definitely combine other surgeries with this, which we'll talk about, but it's a 360 thing. So a body lift, a full body lift, and we'll talk about the different kinds, is treating those areas. You can add on other stuff, and a lot of people do to kind of treat the leg at the same time. Probably more women than men add that on, but that's what it can do.
A body lift will definitely treat the legs, but a thigh lift will treat the legs better.
Yeah.
And a body lift also, especially if it's circumferential, will also treat the mons. That's one thing I didn't say. Where the pubic area is, that tends to be very ptotic or droopy with weight loss, so that can make a big difference there too.
Yeah, and I would consider that all part of the abdomen, like from the pubic symphysis up to the xiphoid process. That's like that full abdomen. Yeah. So types of lower body lift. And I'm calling it lower body lift because we do have an episode where we talk about upper body lift. It's really old. The upper body lift episode
Got to redo it, Aim.
So we will. And that's also why I wanted to make that differentiation, because we're really talking about just lower body lifts in this procedure, or in this podcast. So there's the full 360, like we said, all the way around. There's also the posterior part only, or a butt lift. And those also may include a thigh lift, or more commonly, like some liposuction, usually on the legs.
Yeah, I think I would be surprised if a body lift didn't involve some type of lipo in most cases.
Yeah, of somewhere.
Yeah.
And even if it's just, and we'll talk about that in our part 2, even if it's just to assist in like kind of elevating everything.
Right. And that's what one of the things lipo does is helps you elevate the flaps much easier and actually in a more safe fashion.
Yeah, because it gently kind of breaks everything up, especially if you're using like Vaser or something. Yeah. Let's talk about who's a good candidate for this surgery specifically.
I mean, the realistic things are people that have excess skin and soft tissue, fat of the abdomen, back, and buttocks. So just imagine you're at the end of your trunk as it starts emanating into your lower extremities. That's really where it's treating. A body lift, a circumferential body lift can be combined with a full tummy tuck too. So technically speaking, a circumferential body lift does not also include a tummy tuck per definition, but most of the time you would do that anyways.
Well, so then why would it be circumferential if you were not
because you're technically lifting more down than pulling from above, which is what the tummy tuck does, okay? So you're going to be lifting the anterior thighs, the mons area, and also, more importantly, which people get with massive weight loss, the saddlebag area tends to be really loose and hangy, right? So that's where that body lift lifts. But also, I mean, and Amy already knows this, which I'm not describing it well. If you start lifting your hips and then coming over into the front of your body, it's going to extend almost all the way to midline because of just the way that removal of loose skin works.
Well,
which is the dog ears.
Yeah, the location of it. I mean, you really can't call something circumferential that doesn't go circumferential.
But you can do a circumferential body lift that involves the lower abdomen that does not elevate the abdominoplasty flap past your umbilicus, just so you know.
Right. So but you're still getting
a big part of your abdomen.
You're still addressing the abdomen. Yeah. And I think when you say it doesn't include a tummy tuck, people think it doesn't address the abdomen.
It does address the abdomen.
It does.
Yeah. But you can also do a full tummy tuck at the same time.
Like repairing your diastasis and all the other stuff. Yeah. So either way though, it is addressing the excess skin on the abdomen for sure.
Yeah. So abdomen, back, and buttocks. A little bit the lower extremities. That's overstated. If you go into most offices, they're going to say, oh, yeah, we're going to lift your entire thighs. It's not going to work that way.
But it does, like you said, really get the saddlebags, I think, more than people think.
Right. And it's pretty good on the butt.
Yeah.
It's really good on the front.
Yeah. Well, and part of that, too, just the anatomy of this area, the more an area has to flex, which your buttocks has to flex so you can bend over, the less you're going to be able to pull it extremely tight.
Right. So, well, we'll talk about all this stuff later on, but just to that point, I just have to respond to what you're saying. Yeah. When I do the body lifts and I'm doing the buttocks area, I actually break the table so they are more in a almost not a sitting position, but going toward it.
Yeah, like a little triangle.
So when I close it and they're laying flat and then they go to the bathroom, they don't rip everything out.
Right. Or so bend over.
I close them a little lighter there for that reason.
Yeah. The other things that make a person a good candidate for this surgery or any surgery, that you're healthy enough for surgery, meaning you're a non-smoker, you're at a healthy, stable weight, you have decent skin integrity and muscle tone, and positive outlook and realistic goals. And I think the realistic goals is a good one with this because when you have, for whatever reason, potentially lost a lot of weight and have a lot of excess skin, you can't put the genie back in the bottle. Like we can pull the skin tight, but it's never going to make your skin the skin of someone who didn't go through this process.
Right.
So your skin is never going to be as tight and as smooth potentially as someone who did not have this same weight loss for whatever reason. And this could be from pregnancy. I'm not saying the weight gain was bad. I mean, you could need a body lift because you gained a lot of weight during pregnancy, or there was the patient that we saw, though this is going back like 20 years, who had extreme fluid retention during surgery, and she was young, ended up needing a body lift just because of like a severe medical condition. So, but just know that like those things cannot be fixed with any surgery.
Right.
Like we make them a lot better, but you need to be realistic.
Body lifts really set the foundation, and then you got to do your work with weightlifting and muscle tone and all that kind of stuff to really start building the stuff underneath.
Well, you should have done that already. I mean, like you should do that as part of it.
Maybe you're already doing that, but that's really where the improvements are going to come from after that. So it's impossible. Once that skin has lost its integrity and the elasticity is really minimal, it's impossible even though you want to believe this, it's impossible just to put things back up where they are and all of a sudden the skin seems like it was before. Right. And it just doesn't work that way, unfortunately. And that's pretty much for a majority of people. Every now and then we get these people that are kind of freaking natures and their skin after like these kind of procedures really does kind of fall in line, but that's unusual.
Yeah. Yeah. So, and that's the happy, stable weight too. I mean, I think because this is such a big surgery, it's really important that you be at a stable weight. And that's a weight that you can maintain without extreme dieting, without extreme abuse or use of medications. Like, you need to be able to stay at this weight, because if not, like, you've gone through a really big surgery,
a big surgery with a big recovery that's very expensive.
Yeah.
So this is like a huge investment. You need to have your ducks in order.
Yeah, for sure. So let's take a quick break, and we're going to come back and talk about how to choose a surgeon.
Let's do that.
All right. So this is actually probably the most important part of this whole 2-part series, is how to choose a surgeon. So number
I feel
one,
like we've had an episode on this.
New Beauty Guide, how to choose a surgeon. Yes. It's one of our best episodes because it is so important. You want to make sure that the doctor you're going to is board certified by the American Board of Plastic Surgery or Royal Canadian Mounties, or whoever is certifying boards in your country.
I really don't think that's the name, but I love that you say that every single time.
It's the
dudes on the horses with the maple leaf
the
flags.
Royal College of Surgeons, I think.
Yeah.
Yep. Same thing as it is in the UK, the Royal Academy or Royal College of Surgeons. And just as a reminder, there is no American Board of Medical Specialties recognized.
There's no cosmetic surgery in the name.
That has cosmetic surgery in its name. So a cosmetic surgeon is not the same as a board certified plastic surgeon.
I can't imagine someone going to get this procedure from someone who isn't board certified. That would be crazy.
Oh, Nils. People do crazy things.
Oh, you would be surprised, my friend.
Yeah.
That's like,
I mean, this is the biggest surgery we do, pretty much.
Yeah. Results in aesthetic that match your desired outcome. Now, again, going back to the previous slide, your realistic desired outcome and someone you feel comfortable with. Dr. Martin, what would you tell someone about choosing a surgeon with this surgery
So if you find like maybe you get it from friends or the internet, you get recommendations, you meet with them. But, I think these surgeries, which we do. Every time that gets us.
We got to have like the doo-doo bird pop up every time you say it.
Every doo-doo.
It's a cute little bird.
We do these surgeries. And I think it's important for you as the patient, especially if you're a massive weight loss patient, which is common. These surgeries are common in massive weight loss patients, if that's bariatric, GLP-1s, or on your own, is to maybe be able to see patients that look at pictures that look like you, but also maybe talk to them. And that's helpful because you can hear in their own words what their experience was. It's an amazing accomplishment to lose so much weight, and you want to make sure that the place you're going, because it's very work intensive in the recovery, that the office is attuned to your needs, or at least to the patients before, and they wrap around you as necessary.
And that's where I think someone you feel comfortable with is really key with this surgery, because there is an extended recovery, which we'll talk a lot about in part 2. So you're going to be seeing this doctor and their staff a lot. Right. So, you want to make sure that you feel really comfortable with them. And that may seem like a weird thing to say, but, people get kind of like a little bit of white coat syndrome. Like they see a doctor and they just get kind of like, oh, like I'll do whatever. And then they don't really think about that part of it. Like, do I really want to keep coming back to this office? Is it really far away from my house? Is it fill in the blank? Like all these things, like you're going to need to see this person a lot.
And does the office seem like they're competent in that recovery plan? Do they have adjunctive treatments that help recovery, like hyperbaric oxygen or access to that, lymphatic massage, et cetera? So it's just really good to go to a place that at least does these on a semi-regular basis. Now, FYI, besides primary university settings.
Yeah, there were only 11,000 done in the entire board last year. So no one's doing a ton of these.
Go to somebody and they're like, I do them every week, all the time, 3 times a week. It's probably not the case unless it's a university setting. In a university setting, most universities that have plastic surgery departments are not doing these every week. There are a few. There's a Center of Excellence in Pittsburgh and a few other ones. But in reality, no one's doing these every week all the time. It's just not happening, at least in a reputable private practice setting like ours. But some people do specialize in post-weight loss surgery. Some people don't.
Doesn't mean they're better at it.
Some people are good at it. Some people are not. So you're going to have to do your due diligence, both with making sure they do these surgeries on a semi-regular basis, and also you like the results, and preferably talk to a patient. If you can't talk to a patient, maybe look at the reviews and things like that. Make sure that it seems like everything's lining up. But first person account, I think, is always the best option if you can.
Yeah. All right. So let's talk about what happens at your consultation.
You see an awesome board certified plastic surgeon.
So there's a little bit of a note about the consultation, and this actually comes from the board, and I love this, so I actually put it in here, and it's in part 2 as well because it's a good reminder. The success and safety of your body lift procedure depend on your complete candidness during your consultation. You will be asked many questions about your health, desires, and lifestyle. So yes, we will take a full medical history, including medications, allergies, supplements, history of smoking, even if it was a long time ago, drug use, current or previous surgeries, etc. I think with this surgery specifically too, something else that once you're scheduled for surgery, you should be talked to by at least someone is about your nutritional status before and after surgery, because this is not a surgery that you should be going into in a deficit.
So why is that, Amy? Explain, what is it about body lifts that really force you to focus on your nutrition?
Well, you have an extensive amount of incisional area, and that is going to require a lot of energy. Energy in your body comes from food, what you're putting in, and the substrate that you're putting in. So the quality of what you're putting in is going to be the quality of what your body has available to rebuild yourself with. Mm-hmm. So when you have this amount of incisional area, I mean, we're talking all the way around a person. You know, what most people, average circumference of somebody's hips, depending on the person, is probably, let's just say 36 inches. That is a lot of incision. Mm-hmm. Like, that is a lot of area.
And if you think about people with massive weight loss, they've done it primarily probably by deficits, either surgically induced, medically induced, or just personally they were able to do it.
Yeah, you can't lose weight in a calorie surplus.
So
you've been in a deficit.
That's their norm.
Yeah.
And you can't immediately go in and do a body lift because you won't heal. Yeah. People that have had Roux-en-Y gastric bypasses have malabsorptive issues, and the fat soluble vitamins, the ADEKs. Amy taught me that a long time ago. So those are really important for wound healing. Yeah. And then for people that are on GLP-1s, they can have the side effects of nausea and whatever goes along with that.
The side effect of not eating.
Yeah. Okay.
That's why you're losing weight.
Right.
Or malnourishing yourself.
So it might be hard to get in all the nutrients you need. Yeah. You have to almost double down on eating. And if
the right things.
The right things. It's very equivalent to weightlifting. I keep bringing this up, but like where you want to put the proper nutrients in your body so you'll build muscle, you have to put the proper nutrients in your body so you can heal this wound. This is a very, very long wound. Yeah. And the big risk of this is dehiscence or non-healing areas.
Like wound breakdown. Yeah. So that's an important thing too.
And smoking is the worst thing you can do. Yeah. If you are smoking and you don't tell your surgeon that's 100% on you. Some offices, I'm sure, and probably the university, they just do cotinine levels, which is urine levels of the metabolite that happens when you smoke. So if you smoke and do a body lift, that is a disaster.
Yeah, or even if you're around a smoker, like you need to not be around anyone who's smoking. So other things that happen in the consultation is your doctor will talk to you about your options, expected outcomes, and in most cases provide a surgical quote, review the risks and potential complications, which we're going to talk about next, looking at before and after pictures of similar expected outcomes. And this is where it's key to trust your doctor, because if they show you pictures and you're like, wow, that just doesn't look that great, but they're saying like, this is what you should expect, then this is what you should expect. Or if they're showing you pictures that look too good to be true, there is an important thing here to like.
Amy and I don't always show the best pictures, actually.
No, we show the real pictures.
We show the real pictures.
Yeah.
And fortunately, our results are good, so I'm proud of the real pictures, but we could show them pictures. You're like, oh my God, is that real?
Yeah.
Like you have outcomes like that.
Yes.
Like, this is insane. But you don't want to do that because it sets, it's not fair.
That's not realistic to the person, though. That's my point. Like, similar expected outcomes. Right. So yes, you want to see the majority, not the one outlier that like who had the perfect skin or, didn't really have that much laxity or something. Yeah.
They do a body lift and it looks like everything's normal and it looks like
no visible scarring.
The scar was photoshopped out.
Yes. Yeah. They have no stretch marks. Yeah.
Yeah.
And of course, answer any questions that you have.
It would be funny if it was like clearly photoshopped. It was like a totally different body,
Yes.
afterwards. But the same head. But it was the head from before, like the pre-picture.
Those I'm sure are out there.
Look at this amazing result.
Yes. So some questions to ask your surgeon. We're not going to go over all of these, but there's a few that are really important for this surgery specifically. Primarily, are you going to perform my surgery in an accredited facility? Mm-hmm. That should be you've already made sure that they're board certified, which the only answer to that next question is yes, because board certified plastic surgeons are only operating at accredited facilities. So that should be taken out of it. But I think this is a really good one, Dr. Barnes. So what would you say to someone who asked you, what specific training do you have in lower body lifting techniques?
I think this is actually a really good question. I actually had training in lower body techniques. I trained in Chicago, which had a loss, and actually at a primary center that right when bariatric surgery was really becoming in vogue. So we were getting a lot of patients at the time we were doing body lifts. Chicago is middle America, a lot of weight loss patients there. And then I went to New York and went to a cosmetic fellowship, which we did lower body lifts all the time. Different type of patient subset, a little more of normal weight, but lax skin, just loose skin over time. So these were kind of like body lifts, but mini body lifts. Yeah. So I've done all different types. In Colorado, we have both of those types of patients here. So I actually have definitive training, but not everyone who does plastic surgery gets a thorough and involved training with these kind of procedures. That's the truth. Secondly, if they get out into private practice or they work for a university, not every single person is going to be doing these surgeries. A little hidden secret, these surgeries are work intensive.
Yeah,
they take
not everyone wants to.
Of effort. And, I'm the idiot that loves that kind of stuff. But some of these plastic surgeons, like, there's no way I'm going to do a 6-hour surgery and sew and work the whole time. No way. Today we did a 7-hour surgery. So it just depends. So you're going to have to really kind of feel it out and do your due diligence, But I think that's really good. I think you should just ask that question directly. Mm-hmm. What is your training in lower body lifts? What is your experience in your practice now? And do you feel confident in these types of surgeries?
Yeah. Another good one to ask is, what would happen if you were to gain weight or have a pregnancy? There are definitely people who do this and still want to have children. Is that recommended? And how can you expect your body to age over time? I always remind people, like, these surgeries do not stop the overall general process of aging or gravity.
What? No.
Now with a tummy tuck,
it stops aging and you look amazing forever. Only if you come to our office.
Yeah. With a tummy tuck, we've often said that that is a surgery that you probably only need to do once.
Right.
Because there's just not going to be a lot more redundancy if you maintain your weight. Now, things like the back half of the body, like the posterior part, like, you're going to see some laxity over time.
As you normally would.
Exactly. Like, your legs are still, like, things are still going to age. We're going to talk about the complications in the next slide, but a good question to ask is, what are the risks and complications? Because this, even though it's elective surgery, there are risks and complications. And then, of course, how are those handled? Understanding what kind of help you're going to need. We're going to talk a lot about this in part 2, but you should definitely ask about that. And then, of course, pictures of results that are reasonable for me to expect. I think it's a really good one. So, Dr. Burt, what are some of the big complications or risks? And again, these are not bad things. Like, risks and complications are just things you should be aware of that can be a normal part of recovery from surgery.
So we have a surgery with one of the longest incisions we have in plastic surgery in an extensive surgical area. So the first thing you think about is bleeding.
Yep.
Bleeding around the time of surgery or in delayed fashion. Also, big incisions, big surgical areas, you worry about infection. Those, and especially when it's in your mid-body area, which can have more risk of infection than maybe something that could be more cleaned or better hygiene. The things I think about, which is on this slide, the second one is deep vein thrombosis, and with the secondary effect of deep vein thrombosis would be pulmonary embolus, which is deadly. Mm-hmm. So deep vein thrombosis is blood clots in the deeper veins. It happens specifically with surgeries where the ambulation or walking is compromised. And in this one, you are not immobile, but you have a difficulty of getting around.
You're moving slow.
Yeah.
You're moving slowly.
So a lot of times with these surgeries, at least in our office and the primary centers, we'll put people on Lovenox or low molecular weight heparin or some sort of medication that thins the blood a little bit so you don't get the blood clots. The other stuff, swelling and bruising, I mean, that's with every surgery, But this one, it could be a lot or a little. I've seen both. Amy, why don't you talk about the skin sensation and numbness?
Yeah, and we have a great episode where we talk about numbness after surgery, which we'll put here. And those things are normal, but there can be changes in the skin sensation or numbness that persist after surgery, as can some pain. Just because of the pressure that's kind of put on the nerves in certain areas. We plicate through some, we cut through some. So like those sensations can linger for a long time. And actually, if you look at plasticsurgery.org, it says that full recovery from a body lift can be expected to be up to 2 years. And that's an important thing to think about ahead of time. So like, yes, you may have pain that persists. It might just disappear at 2 years. It might take 18 months. It might be 6 months. But like, that is, again, a kind of normal, quote unquote, complication. Poor wound healing and skin loss, Dr. Martin covered. The bleeding after surgery. Asymmetry, again, when you are lifting this much tissue, some asymmetries could persist.
Right. So, yeah.
Because you just don't know sometimes. You're lifting so much.
We talked about this with brachioplasty. Oh, by the way, the best comment on that was like, I love the comments where they're basically dogging me. Whatever the comment was, it was like, he said he's not going to talk about himself, and then he immediately talked about himself for 15 minutes, which is kind of true. I'm so passionate about surgery, and this is a surgery podcast.
That's why, and I responded to that. He is the surgeon in Beauty and the Surgeon.
Yeah, I know.
So,
but
yeah.
It was like kind of true. I kind of liked it. I wanted to give her a fist bump or him. Anyways, it's impossible. It's almost impossible to do something three-dimensionally, circumferentially around your body and make everything line up perfectly. But let me tell you something. I try really, really, really hard to do that, and I get really, really close almost all the time. So you can get it better than you would want, but not quote unquote perfect symmetry. The other thing I wanted to talk about, this skin loss, we kind of brushed over that. When you have these big areas of elevation, big areas of pull, big areas of tension, if you don't have good circulation, if you have a smoking history, you're not healthy, those will break down. And when those break down, it creates something called a dehiscence, which is the other major issue with this surgery. As the wound pops open and you have these open areas, Amy and I have dealt with people.
Oh, they take weeks to close.
Not our patients who have like come to us because they've gone like overseas or in Mexico.
Well, we've had patients who've had some dehiscence after surgery.
Also had a few patients have dehiscence after surgery.
Almost all of them have a diabetic history, but some of them don't.
Yeah.
Like it happens. Like when you're dealing with this amount of incision, like it can happen.
And once that dehiscence occurs, pretty much you have to do wound care and packing. And that could be, you're kind of adding insult to injury. You're recovering from this really hard procedure, and then you have to do wound care afterwards.
Well, or you have to have somebody else do it for you because it's on your back, and you can't do it yourself. So yes. Unfavorable scarring. Yeah. Again, you got an area of a scar that's 36 inches long. There could possibly be areas that you don't like the way they look. These things can be fixed. We have a great episode on scar revisions. And of course, need for additional surgery. And this, again, this is a risk of any surgery. Like you can never go back. So you have surgery, like there may be another surgery that you need just because of this surgery. Like that is absolutely something you need to know about.
Everybody wants you to pull as tight as possible on a body lift, but the tighter you pull, the more likely you're going to have hypertrophic or bad scarring.
And dehiscence and other problems.
So we'll talk about this next episode. I do these deeper sutures to try to take the tension off the skin, but it's almost impossible to take all the tension off. And Amy didn't even talk about the drains, which we'll talk about the next episode. You're going to have multiple drains.
Because drains are not a risk or a complication. They're a thing. These are risks and complications.
They're a thing.
Yeah. A drain is not a risk of this surgery. It is a foregone conclusion.
Yeah, it's going to be. And so if someone says they're doing a body lift without drains.
Oh, don't go to them.
Yeah.
Like you need the drains. One other thing that I think is important to kind of know about this is that you could have some persistent swelling in your lower legs, in your limbs. And this is because when we are making an incision all the way around a person, we are cutting through a lot of the lymphatics. Those things, regenerate and start working again, and they find ways to work around. But until then, like you could have some swelling in your legs, and you need to be aware of that.
Yeah.
Like not to let that, because again, if you let this swelling go unchecked or you're not mobilizing like you're supposed to be, that swelling could become a problem. Mm-hmm. You could end up having issues with electrolyte balance and dehydration, which is also why it is so important to be nutritionally sound before you go into this surgery.
So you can even see that swelling with extended tummy tucks or belt lipectomies, which are all these things are kind of all weaving in together. By the way, trunk surgery that's done three-dimensionally, you can have different names. You can have a belt lipectomy, you can do, you can have a butt lift and then a tummy tuck. If they're all connected together, you're basically kind of approaching a body lift.
Mm-hmm. Yeah. But so swelling in the, the dependent areas of the body is definitely something to be aware of. So, but again, just because there are risks and complications doesn't mean that these things are bad or totally unexpected or
it's one of the most transformative surgeries we do.
Yeah.
And even though it's a big recovery and a big surgery and it's not cheap, some of these patients, the before and afters are crazy.
Oh yeah, they're transformative.
Yeah.
And again, big surgery, big transformation. Big transformation. Yeah. All right. Well, so that's it for part one.
Part uno.
In part two, we're going to talk again about the specifics of the surgery, the part that, like Dr. Moore said, everybody really wants to know about.
That's why you guys came.
It is. So that's why you're going to come back in 2 weeks. We're also going to talk a lot about recovery because with this surgery, there is a lot of recovery. So, and there's a lot to be aware of for recovery. And the more prepared you are going in, the better your recovery will go, regardless of how it goes. It's always better to be prepared.
I'm glad you're admitting now that you're the beauty and I'm the surgeon, because I think you tried to convince me that I was the beauty and you were the surgeon?
No, I'm a nutritional therapy practitioner. Mm-hmm. I've always been.
You reminded me of that.
Yeah. Nils is the beauty.
Nils is the beauty. You're the nutritional therapist. I'm the surgeon. It's like a
surgeon.
triad.
Yes. This is how it works. All right.
I mean, I always thought Nils was handsome, but a beauty? I mean, is he beautiful?
I think so. Look at him.
Sarah's beautiful, but Nils.
Sarah's beautiful. Yeah. All right. If you want to see Nils, you have to go back and watch either our 100th episode
Yeah.
or
Ooh,
Plat-
wait till September 15th.
right. Wait for our 200th episode.
Our
You'll see him
200th
again.
episode.
200.
Yeah. You were also, Nils was also on the future of plastic surgery, where I made him ask
That
questions.
was a really fun episode.
That was a
Yes.
great
Yeah.
episode.
Yes, we might be doing another game show-ish type thing.
I think we should.
Love it.
Yes, in a month
Yeah.
or so.
I'll bring the popsicle or the tongue depressors to make some janky signs out of a
Yes.
file folder and popsicle.
It was so
tongue depressors.
embarrassing.
Those are great.
I'm like, we're a top-notch, office, and we got the tongue depressor.
I made those the night
signs.
before with stuff I found in my office. So I thought that was pretty.
You did
It was
great.
good, actually.
It
I have
was
to admit,
good.
it was
better
really
than
good.
I would have done.
Yeah. All right. So until next time, you can find us on all of our social media handles here. We are at Beauty and the Surgeon Podcast, at Jason Martin MD. You can also leave me a voicemail or send me a text at 303-630-9038. And we will see you all here next time.
Next time.